Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
All of the following are the statements about testicular feminizing syndrome are correct except. So, a patient has XY genotype, pubic hair is not present, short vagina may be present, and ovaries are absent. So, this is the wrong statement. Pubic hair is not present. 16-year-old female presents with primary amenorrhea and bilateral inguinal hernia. She has normal sexual development and no pubic hair. USG shows no uterus. Ovaries are also not present. A blind vagina is present. Diagnosis is here there is primary amenorrhea with bilateral inguinal hernia. She has normal sexual development and no pubic hair, no uterus. So no pubic hair, no uterus, and ovaries are absent, and there is blind vagina, bilateral inguinal hernia. This is actually a case of androgen insensitivity syndrome or testicular feminizing syndrome. That among the following, which of the following is a feature of testicular feminizing syndrome? The pattern is XY, rare has females, well developed female internal genitalia false, there is no ovary, no uterus, then high testosterone levels will be seen because of the receptor insensitivity.
thank you and thank you for watching.